This is a loading technique to the stuff in between your shoulder blades that's in the middle back. So it covers this area roughly here to roughly right in through here on either side. What you're going to need is a ball. You're going to place this ball against the wall. So right now you won't be able to see exactly what I'm doing, but the most important part is the body position. So I'm going to place this ball against the wall, my body sandwiching the ball that's against the wall. Once I find an area, there's two different ways that you can work on it. The first way is more of the seek and destroy. So right now, I'm seeking an area that I need to work on. Once I find a sensitive area, I'm going to hold that there. To destroy it, what I'm going to do is I'm just going to apply pressure to it. So right now my tush is anchored down towards the wall. I'm going to take a breath in. When I exhale, I'm going to try to apply a little bit more pressure into the ball that's against the wall and try to totally relax the arm. And then I'll do that exact same thing. I'm going to take a breath in, exhale, and then just try to melt over the ball. Once it desensitizes, then you can move to another spot. So the second technique you can use is more of the pin and stretch. So I'm going to do the exact same thing. I'm going to find an area that's sensitive. Once I find an area that's sensitive, I'm going to hold that there. I'm going to apply pressure with my body against the wall. That's pinning it down. Then from there, you can do variations with how you want to stretch it. The first thing you can do is you can turn your head away and look down and allow some assistance with your hand and apply pressure downward and hold that a little bit more. But I would recommend to keep the arm of the side that you're working on, keep it relaxed and have this hand do the most of the work. Let's say after you move your head this way, then what you can do is you can give yourself a hug. So I'm going to slowly give myself a hug, and when I give myself a hug, the moment that this arm can grab this arm and bring it across a little bit more, I'm going to do that so this side doesn't have to contract. I'm just going to hold that position and then relax it. Or you can couple both movements together. So what I'm going to do is I'm first going to hug myself. Once this hand can grab the opposite arm, the treatment side arm, I'm going to bring it across a little bit further. Hold that down, then I'm going to turn my head. So I'm going to turn my head away from the side I'm working on, and then I'm looking down. As you start to hold the position, it'll start to melt and become desensitized. That's when you can progress to another level.